All right, guys, so we're almost done with trauma. This is the second to last chapter. We're going to talk about abdominal and genitourinary injuries. So this is kind of this, a lot of this is going back to that anatomy and physiology stuff that hopefully you're still learning. So we're going to talk a lot about organs and just where to find them and what are some of the injuries that can happen if something goes wrong. Injuries to the abdomen that go unrecognized or not repaired can lead to death. I've definitely seen that before. So any sort of abdominal injury, I would evacuate to the hospital or get some sort of higher care to look at it. I don't usually mess around with the abdomen. It's pretty complicated. You can't see anything in there, right? So better safe than sorry for that one. So this right here, take a picture of it, write in your notes, do whatever. This is going to be on the test. I guarantee it. I'm just going to say name an organ in the left upper quadrant, or which organ is this or whatever. So I'm going to have questions based on these. So got to know. And there you go, in case you didn't know what we're talking about for quadrants. All right, hollow organs. You got to know the difference between hollow and solid organs. So it's those four. And what we're worried about here is when there's some sort of laceration and now all the content spills out. So basically all the stuff that's in our organs needs to stay in our organs, and if it comes out of our organs, it pretty much immediately causes problems. So this is just a little bit more focused on the small intestine. Remember duodenum, jejunum, and ileum. If you have trouble remembering that, we could just call it DJ ileum. Sounds like a cool dude, but that's how I always remembered the order of the small intestine. Large intestine, cecum, colon, rectum. And the mesentery is it's just kind of the name of some of the connecting bits that kind of anchors the intestines into the abdominal wall. All right, solid organs: liver, spleen, pancreas, kidneys. They do a lot of stuff, and that means that they have a very rich blood supply. So if you have a hemorrhage to any of these, you can absolutely bleed out internally. It's not a very good system. So there you go. There's a picture of our solid organ. Okay, so we can talk about closed versus abdominal injuries. So a very common cause of a closed abdominal injury is going to be compression from like a seat belt or something. That usually gets people, especially if the seat belt's not in quite the right place. Yeah, being run over by a vehicle, definitely. I will send you guys a video attached to this lecture about a guy over in Asia who was on a motorcycle and he gets hit by a car, and you can actually see the surgery and everything that happens. So it's pretty amazing. So you can learn more about that in the video. Okay. So just remember these signs and symptoms. A lot of times abdominal pain is going to be diffuse, meaning that it's kind of in a broader area. It's not like a penetrating injury where it's like, yep, right there is a spot. A lot of these times the abdominal injuries, it's kind of a generalized area. It's not so much like a pinpoint area. So you're going to see a patient who's guarding. You might even see some distension. That just means there's a buildup of fluid or blood or organ contents that's not supposed to be there. Abdominal bruising and discoloration. Now that's a later sign, but you still got to look out for it. And there you go. And it initially may appear as abrasion, but it will become bruises. So what we just talked about, seatbelts are great, but you can wear them incorrectly, and that can cause some injury. So just make sure that everyone's wearing a correct seatbelt. Airbags, same idea, are great. It's definitely a good thing we have them, but they can also cause some injuries. So just got to be careful with those. So there you go. You can see from that incorrect picture on the top, if that's where the belt is, you can see that it's causing a lot of damage when you have those deceleration injuries. Okay, so open abdominal injury. Penetrating injuries, right? That's when some sort of object, stab wound, gunshot wound, something or other has opened into the abdominal cavity. All right, injury depends on velocity of the object. We've already talked about this in some previous lectures, just about the difference between like a low velocity and a high velocity weapon. So low velocity is going to be like knives and baseball bat and stuff like that. Because we're talking basically low velocity is kind of like human powered, like that's what's providing the energy to move that object. Whereas medium velocity and high velocity, that's generally some sort of machine or tool is involved. So medium velocity shotguns and handguns, high velocity, high powered rifles and handguns. At the end of the day, for abdominal injuries, that doesn't make a ton of difference because either way, you have some sort of penetrating object now in the abdomen. So if you guys remember from the previous lectures, we talked about that cavitation, where it's that pressure wave that just for a second really expands the tissue and the tissue will shrink back. But of course, that causes a lot of damage when there's that cavitation. Low velocity injuries, basically, you can't always tell what happened at first because it's low velocity. It might take a while for some of that damage to show up. So like I said before, any sort of involvement in the abdominal cavity, any sort of injury to the abdominal area, I wouldn't risk it. I would definitely get that. So an evisceration, this is like the easiest one to see. And in that video, I can send it with the motorcyclist. That's what he has. Yes, it can be painful and visually shocking. No one wants to see their own guts coming out. So if you do have that situation, make sure the patient is like looking away, and don't let the patient get a lot of anxiety, because that's just gonna make everything worse. It won't help out the treatment or anything. So just make sure they're not looking at it. If there's an evisceration, so we know like the organs are coming out, we don't want to be palpating a lot and shoving our hands everywhere, because we know the damage, we can see the damage. Generally, we don't want to pull out the clothing or anything that's in that wound channel. We just kind of want to leave everything where it is, when possible. So signs and symptoms, it's going to be very, very painful. Tachycardia, because you're going to have some blood loss with these abdominal injuries. And as you guys, if you can remember from like the shock stuff, if you're down a bunch of fluid, your heart rate is going to go up to make up for the pressure difference, right? And then you're going to maintain your normal blood pressure by the heart beating a lot faster. Now, later signs, so initially, you may not see any alteration, at least initially, of changes in mental status, evidence of shock, distended abdomen, things like that. You may initially not actually see those. If you guys have ever seen the movie Reservoir Dogs with Quentin Tarantino, I recommend it. There's a guy in the movie who's been shot in the stomach, and you can kind of see him go down this cascade as the movie goes on. So like we just said, so hollow organ injuries, just similar to some of your other abdominal injuries, it can take a while for the signs and symptoms to really show up. So that's why, and by then it's kind of too late, right? So that's why we're being so paranoid about this. Especially if you have like an infection or something, the body can go septic shock real quick. So once again, anything in the abdomen, don't mess around with it. You can literally, the organs can actually kind of pop. They can kind of rupture under that pressure, or of course you have some sort of penetrating injury. So be careful of that. Just an example of an organ popping. I heard a terrible story where a person had to go to the bathroom and was speeding to go home, and the bladder was just massively full. Like the bladder can really only hold like 600 milliliters is about like when it starts to get really painful. I don't know how big the bladder was, but the bladder was definitely like over capacity. And the person got in a car accident and the bladder just ruptured inside his body. And there's nothing you can do about that. So the whole idea of like organs rupturing actually does happen. You can bleed a lot, like I said, or a little bit, just kind of depends on what's been suffered. All right, the liver is the largest organ in the abdomen. It's very, very vascular. There's a lot of blood flow that goes through the liver. And if you lacerate that liver, that blood's coming right out. So we're definitely really worried about liver lacerations. Spleen and pancreas, same idea. Very vascular, very prone to heavy bleeding if that happens. Motor vehicle collision, steering wheel trauma can do a lot of damage. Bicycle, those handlebars gets a lot of people, and even people who have come down with mono or the Epstein-Barr virus, whatever you want to call it. One of the signs and symptoms is an enlarged spleen, because the spleen is working through the virus. And if people play contact sports while with having mono, their spleen can rupture and they can die from blood loss. So it's definitely a concern that we see even in your high school population. Okay, the diaphragm. Obviously, we need the diaphragm to breathe. It's a very important, weird little paper-like organ that moves around. And it's kind of the dividing line between the chest and the abdomen. And if you somehow put a hole in there, the abdomen, the contents of the abdomen can absolutely herniate up into the chest cavity. For example, if you're listening to lung sounds and you hear bowel sounds, you know you're in trouble. Kidneys. Yes, you can have a lot of blood loss to your kidneys. Common finding is blood in the urine. That's actually there's a few different things can cause that. Like boxers, they always go for those body hits, and even just some light trauma on the outside of the body can cause blood in the urine. Okay, so basically for this, when this happens, these abdominal injuries, we really want to investigate the mechanism of injury and really find out what happened. Identify signs, symptoms, pertinent negatives, sure. We're going to try to minimize patient movement, right? You try and lay them down as quick as possible, and you want to bring their knees up because if your legs are out straight, there's actually a little bit of pressure in the abdominal wall when you do that. So that's the last thing we need for an abdominal injury. So we just want to make sure we bring those up. Okay, sample. You guys know this sample OPRST, just same old, same old. I always ask that for everything. Specifically ask about nausea, vomiting, diarrhea. Those are pretty pertinent things to ask about. All right, examine the entire abdomen. So remember, if there's an entrance wound, there might be an exit wound. So we do want to do a full check. And you can listen to bowel sounds with your stethoscope. And basically, hypoactive just means you can't hear anything. Hyperactive is you can tell it makes a lot of noise. If you ever have listened to hyperactive bowel sounds, I can put a link up on YouTube. It does make quite a bit of noise. However, pre-hospital, ambulance, whatever, I don't know if we would really how beneficial that is for us. If we for some reason have a longer evac, like if you're working rural EMS and you have like a 2 or 3 hour evac, well then maybe you could listen to bowel sounds, but at least initially. Okay, DCAP BTLS. We talked about this weeks ago. If you guys remembered, it's just look for stuff in the abdomen that is wrong, right? Look for bad stuff. So we kind of divide the abdomen into 4 quadrants based on the belly button, like I showed you earlier. We want to basically start at the furthest quadrant away from the injury and then palpate that way. It's better to go to kind of do least to most. So we want to do that. You can put both your hands together and you just kind of roll your hand on the top of the abdomen and you're feeling for tenderness, rigidity, or distension, patient pain, stuff like that. Remember, just like always, do not remove any impaled objects, even if it's in the abdomen. Just want to stabilize that guy in evac. Okay, this is just kind of a once over the world of some closed abdominal injuries, and these are just examples. However, for us, it's all the same treatment. It's evac, evac, evac. They need a surgeon. Okay. Yeah, so for open wounds, in a way, it's nice and easy because we can see everything that's happening. We know we know where the wound is because we can see the blood coming out. Those kind of diffuse, just, oh, my stomach really hurts, I don't know what's going on. Those are very, very hard to figure out, like pre-hospital. And that's why they call them internal medicine. That's like there's doctors who are devoted to just like abdominal injuries. So definitely something that not a lot we can do about. So we need to go to the hospital. So there you go. There's just a picture of evisceration. See, we have this fascia that kind of holds all the guts in, and so there's a little bit of pressure there because it's pressure, pressing against the fascia. Well, you put a hole in that fascia, and those organs can just herniate right out, which is what happened in that picture. All right. So key things here, stuff you'll see in the test, and stuff that we don't want you doing in real life. Do not try and replace the protruding organ. In the Army, there's some talk about doing that, but obviously in the military, in my line of work, we might be a day away from a medevac, just depending on where we are. So then if you're looking at something crazy like that, then maybe you want to reintroduce the organ. But at our level, at the civilian level, just keep the organs moist and warm because now if that organ dries out, it dies. So we're like, especially like intestines. So you can use an occlusive dressing or even like a plastic bag. Just put whatever guts that are spilling out, put them in a plastic bag, secure it to the skin, and then wrap it up. And that way, it'll at least keep it more warm and moist than doing nothing. All right, so this is the fun stuff. Everyone loves talking about this. This is the genitourinary system. Same idea. Not a ton we can do for this. This is also like a surgeon kind of thing if it's bad enough. So. Okay, so kidney damage, we'll talk about that real quick. If there's any sort of abrasion, laceration, contusion in the flank, which is just kind of right in your back there on either side of the spine, you have your lower back. You see any sort of those things, you might see some blood in the urine later. Any sort of penetrating wound in that same area, bad news. Fractures on either side of the lower rib cage. If you think about it, if you can feel on your back, you feel kind of where your flank is, and then you can feel where your ribs are, and they're actually pretty close. So sometimes if there's on your back a lower rib fracture, there could be some involvement. All right, we already talked about this. Like I said, the bladder is a hollow organ. It can be tricky. Once it gets really, really full, it can definitely rupture. So, and that's a very complicated problem. Okay, talking about external male genitalia. Painful and great concern for the patient, obviously. However, it's rarely life-threatening, and it should not be given priority over more severe or after more like severe wounds. And that happens. People get tunnel vision, and they think that, you know, oh man, I have to. This is a big deal. I better work on this right now. And then you miss an arterial wound on the foot or something. So yes, it's scary and it looks terrifying, but it's okay. Direct pressure and evac. So for female, there's lots of stuff going on inside the body, but at this point it kind of becomes that like an abdominal wound. It's all internal, not a ton we can do. So, however, any sort of female genitalia injury, you kind of have to ask about sexual assault. You kind of want to look into that mechanism of injury. And if that is something, then you need to report that up. Basically, you can just apply pressure just like male genitalia. Just apply pressure on the outside and just apply pressure, use some ace bandages or something, and take to the hospital. All right, so yes, it could be very embarrassing. Maintain a professional presence, provide privacy when possible. Try to have some same gender EMT if you can, and then also if you've had to strip them down for a trauma assessment or something, do look inside the clothes and see if they're bleeding anywhere. So we just talked about this already. So nausea, vomiting, diarrhea, blood and urine, vomiting blood, abnormal bowel or bladder habits, all of those things are red flags or something wrong. Okay. Kidney injuries may not be obvious, but if they're bad enough, you can see some signs of shock, and you could see blood and urine. But remember, at that point, it's just take them to the hospital. Surgeon needs to do something about it. We can't do a ton. Same idea. So these are all the same, basically. Sucks for that patient. Take them to the hospital. There you go. Moist, compress, cover the area, just what we talked about. If there's some sort of amputation or something, treat it just like an amputated finger or an arm. Just keep the amputated part and maybe they can reattach it. Yes, you can have a penile shaft fracture. There's a video I can send about a doctor. It actually happened to a doctor, and so he's talking about it. So I can send that on the YouTube comments if you guys wanted to see kind of like his version of it, what happened to him. So yeah, these are all things that can happen. If you guys have ever seen the movie Something About Mary, there's a zipper bit that's pretty entertaining. And really, if some sort of skin is caught in the zipper, it's very painful, and it initially looks complicated because how you're going to do it, right? But if you actually come in on the bottom and you just cut from the bottom, and then the zipper will actually just kind of unfold. But if you're going through the top, it's going to want to zip. Urethral injuries are not uncommon, so straddle injuries, pelvic fractures, all that fun stuff like riding horses or motorcycle accidents, those things can do it. If for whatever reason the patient's been saving the urine, and that does happen, some doctors want their patients to do that, you can bring a sample of that urine to the hospital because they'll want to test it. All right, just like we've already said, we want to just apply pressure, moist sterile dressing, evac. Okay, just same as men, just moist sterile dressing. We don't want to pack anything into the vagina just because there's, we'll have to get that out later, right? And that's probably not where the problem is anyway. So we kind of want to avoid that. Now, if there's any foreign bodies in there for whatever reason, like assault or something, we can't leave those in there. They are painful, but not necessarily life-threatening. But either way, especially if it's a sexual assault, take them to the hospital. Okay, rectal bleeding. This can happen from like a few things: sexual assault, hemorrhoids, colitis, ulcers, Crohn's disease, different things like that can do it. So It is something you might see, and just ask about it. That slide's absolutely correct. But really, acute rectal bleeding should never be passed off as something minor. Any sort of rectal bleeding is serious, and you definitely need to take them to a doctor. So they're just saying is do your best, just like any genitalia wound, just apply pressure best you can with some Curlex and evac. Okay, we've already talked about this a little bit, but sexual assault, yes, it's generally women, but it can happen to men too. And it says right there, some often little you can do beyond providing compassion and transport, and that is true. Remember though, try to maintain like the same gender EMT. So if you get called to a male or to a female, if you're a guy and you get called to a female sexual assault thing, see if you could work something around with a different ambulance or something to have a female present there. These women are usually in pretty bad shape psychologically, and potentially having another guy run around, especially in that area, would not be good. So try and have the same gender. Really, we don't want to examine a lot of genitalia unless, of course, we need to. But we kind of want to leave all that alone, especially because it's kind of like the crime scene. So we don't want to be poking around there and potentially getting rid of some evidence. Do your best to shield the patient from like onlookers. That's going to happen. So throw them in the ambulance, throw a tarp over them, a blanket. Really, you can do whatever you can to keep the privacy because we're going to be looking. Just remember, it is, like I just said, it is a crime scene. Okay, like that is where the crime scene is. So just leave everything alone. So no showering, can't go to the bathroom, maybe brush your teeth. Don't do anything. Same with the clothes. Don't mess with the clothes either. I mean, this is all crime scene type stuff. And if someone was sexually assaulted, we're going to want to figure out who that person was. And the best shot we have for that is to leave all that stuff alone until the examination can take place. So psychologically support, bleeding control if there is some, and then take them to the hospital. Okay, so that was your quick down and dirty class on abdominal injuries. So we have one more, which I'll record either Thursday or Friday. And then I will put out a study guide for you guys to look over the weekend. And then on Monday, we will take our test. You will have, unless of course the school would change the schedule around, but we'll take the test next week. Thanks.